Hi, I'm Kristen, and I'm going to be doing the Ethical Leader presentation. So I'm going to be doing my presentation on the career of athletic training. Athletic training is a healthcare profession that provides care to a variety of different individuals and in a variety of different settings. And the care may include aspects of prevention, diagnosis, treatment, and rehabilitation of both acute and chronic injuries or medical conditions. So it's really a vast amount of information and care in a variety of different things. But for the purpose of this presentation, I'm going to be focusing on the field of athletic training in the high school and university setting because those settings do have a unique leadership role as well as unique ethical considerations and dilemmas that may pop up in that setting. So we'll just dive right in. My leadership style currently, I would consider to be transactional, which is a motivation through the exchange of resources. I tend to motivate my athlete by saying things like, okay, if you do this exercise, it will help you return to play that much quicker. However, I would like to include more transformational styles in my personal practice as an athletic trainer, which is a motivation and a promotion of extra effort provided by myself, the leader. I want to include this because it has been shown to be very effective in numerous settings with a variety of individuals, with the setting of athletic training being no different. With that being said, a leadership strategy I hope to implement is transformational leadership. Again, it's the setting of high performance expectations using inspirational motivation and maintaining individual consideration. So it's a leadership by example, encouraging growth, inspiring them, while empowering them and uh, doing so in a very relational way. Um, Noting that relationships are different with each person, so maintaining that and encouraging differences in that. Transformational leadership has been shown to buffer the effects of certain personality traits, those being um, the effects of extroversion and neuroticism in training. It has also been shown to improve the athlete-athletic trainer relationship in sports medicine settings. And again, it can be implemented by really placing an emphasis on relationships while setting high standards for your athletes. The next leadership strategy I hope to implement is situational leadership. Athletic training in the high school and collegiate setting is really unique because not only are we kind of in charge of leading our athletes through various protocols, but we may also have the unique responsibility of student athletes, them being under our care and supervising them and trying to foster their education as well. So situational leadership is managing others according to their skill level through methods of directing, coaching, supporting, and delegating. And this is super interesting because it matches an individual's skills, confidence, and competence with a leadership style that best matches that and provides the appropriate direction and support based on the individual's motivation, goals, and needs. So it's very interesting. It's micromanaging when you need to micromanage. It's delegating when the individual needs you to delegate, and stuff like that. So it's very effective and can be very interesting in the field of athletic training. The next thing we're going to be talking about is various ethical issues in the field of athletic training. The two that I'm really going to focus on are return to play decisions and maintaining professional boundaries. But first, return to play decisions are very common in athletic training, especially in the high school collegiate setting. We're always going to be trying to return our athletes to the sport they love as quickly as possible, while also trying to maintain the ethical standards and remembering that their safety should be of the utmost importance. So a few strategies that have been found to kind of help this process because it can be challenging with stresses from coaches, athletes, parents, athletic directors, the school, booster club. There's stresses from everyone kind of pressuring us to return athletes as quickly as possible. So some strategies to mitigate those are clear communications and the setting of clear expectations, which have been shown to help minimize conflicts in this process. So really communicating and saying, these are our expectations, I need this, 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 and this to be done before the athlete can return to play, or before I will allow the athlete to return to play. Another strategy that has been shown to be effective is the 4-topic method, and it can be beneficial when solving dilemmas because many dilemmas are very fluid and have very different situational things going on. So really to break it down into 4 topics kind of helps make the situation a little bit more black and white. Those 4 topics, as shown in this graphic over to the right, are medical indications, patient preferences, quality of life, and contextual features. So breaking a situation down, is it medically okay for the athlete to return to play? Patient preferences. Does the patient want to return to play? Are they afraid? Are they excited? Quality of life. Will returning this athlete to play, will it increase their quality of life? Does it have the potential to decrease their quality of life? And then contextual features. That includes context beyond yourself and the athlete, which may include the parents. What does the parent want? Does the parent want the athlete to stay out of for another week? Any laws, any school policy, and things like that. And those 4 things may help clear up any kind of grayness in return to play decisions. The next ethical issue I'm going to discuss is professional boundaries. Young athletic trainers may easily have professional boundaries being blurred for them due to various age gaps and similarities with their athletes and subordinates. So it's really important for athletic trainers to maintain their integrity in their professional relationships. Those relationships include those with athletes, with teachers, with coaches, with athletic directors, with coworkers, all of the above. Just maintaining the highest standard for yourself. Another, again, is to really clearly outline your role and responsibilities to ensure the trust and respect of your professional boundaries. So with your student athletes, really outlining what your position is in their school and kind of in their life, and that will help with the respect of professional boundaries. One article by Peregrine really outlined specific behaviors that help with professional boundaries and the creation of those. Those include prohibiting any behaviors that may be interpreted as having inappropriate or sexual overtones, Avoid revealing any personal contact information as well as any privileged information regarding yourself or any other athlete. Refraining from self-disclosure, so really only revealing things about yourself that need to be revealed. Anything kind of beyond that you should avoid. And then remaining aware of your situation, aware of your surroundings, aware of who you're with. And lastly, documenting any inappropriate behaviors. The documentation is huge in athletic training and will really help if any legal issues then arise. So this comic over here, although it's a psychiatrist, I really think it also can apply to athletic training. And as athletic trainers, we need to remember that we're dealing with clients as a healthcare professional, and all of our actions should reflect that. So with that, I'll jump in to some recommendations to uplifting the profession and becoming the best leader, and making the best ethical decisions we can. The first is be aware of your practices and be constantly learning from any actions and mistakes in order to become the best leader and athletic trainer you possibly can. I really think being a lifelong learner is valuable in any profession, and athletic training is no exception. And the next is really important. Remember any professional guidelines and potential legal issues when making ethical decisions. This poster over here by the NATA is really a good guideline for what athletic trainers should strive to be, in that it kind of outlines putting the patient's well-being first, providing compassionate health care, being an advocate for the patient, acting with integrity, upholding the NATA Code of Ethics, as well as complying with any laws and regulation in promoting the highest quality healthcare we possibly can. So a few things to think about. Because we're going to a Christian university, it's important to think about how we can integrate our Christian faith into a leadership role while maintaining integrity in decision making. And how do we do this in a workplace that may not promote or even tolerate religion? So one thing that I think is really interesting is we talked about transformational leadership before, and how that's really creating relationships and leading by example. And I think that kind of ties in with the Christian faith really well, in that we can lead by example. One Bible verse that really sticks out to me is Matthew 7:12. Do unto others as you would have them do to you. So really putting that into action, and although we may not be verbally or vocally being like, yes, Christianity, all of that, we can really present that through our actions, and in our decision making. But one thing that's really important to remember in any workplace is to be respectful of others. So not prophesizing or anything like that in a situation that doesn't really call for it, and just being respectful of others, others' faith, others' ideals, and things like that. Last but not least, we have our references, and hopefully that is helpful in our ethical leader presentation. Thanks.